My 7-year-old broke a kid's jaw, and the surgeon asked for her autograph. I was sitting in a client meeting when my phone buzzed for the third time in 2 minutes. The first call was from Oakwood Elementary. The second was from someone identifying themselves as Officer Caldwell with the county police. The third was a text from the school principal that just said, "Please come immediately. Situation urgent." My hands went cold as I excused myself from the conference room, my mind racing through every possible scenario. My daughter Lily was 7 years old, quiet, the kind of kid who brought home injured birds and cried during sad commercials. Whatever situation was urgent enough for the police to be involved couldn't possibly be what I was imagining. The drive to the school took 12 minutes that felt like hours, and when I pulled into the parking lot, I saw 2 squad cars parked near the entrance, their lights off, but their presence unmistakable. My stomach dropped as I walked through the front doors, trying to control my breathing and failing completely. The receptionist's face told me everything before she even spoke, that practiced look of professional concern mixed with something that might have been pity or judgment. She directed me to the principal's office without making eye contact, and I could hear raised voices echoing down the hallway before I even reached the door. Principal Delacroix stood when I entered, her expression grave as she gestured to a chair, but I remained standing because sitting felt like accepting whatever nightmare was about to unfold. Across from her desk sat a couple I recognized vaguely from school events, the Ashfords, both wearing expensive suits that screamed lawyer even before they introduced themselves. Their son Damien sat between them with an ice pack pressed to his face, and I could see the swelling even from where I stood near the doorway. Mrs. Ashford spoke first, her voice sharp and controlled in that way people sound when they're containing rage behind professional courtesy. She informed me that my daughter had violently assaulted their son on school property, causing severe injuries that would require surgery and potentially permanent damage. Mr. Ashford added that they were both attorneys and would be pressing criminal charges for assault, along with a civil suit for damages they estimated at $500,000. The number hung in the air like a guillotine blade, and I felt my knees actually weaken before I forced myself to stay upright and focused. "Where was Lily?" I asked, my voice coming out steadier than I felt. Principal Delacroix explained that she was in the nurse's office being evaluated, and that was when Officer Caldwell stepped forward from where he'd been standing by the window. He was younger than I expected, maybe early 30s, with the kind face of someone who probably hated this part of his job. He told me that based on the severity of the injuries and witness statements, he would need to take Lily to the station for processing, and my heart actually stopped beating for a second. Processing meant fingerprints and photographs and my 7-year-old daughter being treated like a criminal, and I couldn't reconcile that image with the child who still asked me to check for monsters under her bed. The Ashfords started talking over each other then, describing the attack as vicious and unprovoked, explaining how their son had been minding his own business when Lily had apparently lost control and struck him hard enough to break his jaw in 3 places. Mrs. Ashford pulled out her phone and showed me a photo of Damien's face from what must have been right after the incident, the swelling already severe, his jaw visibly misaligned. It looked horrific, and I felt sick looking at it, but something didn't add up because Lily weighed maybe 50 pounds soaking wet and had never shown any signs of aggression in her entire life. I asked if I could see my daughter first before we discussed anything else, and Principal Delacroix nodded, leading me down the hallway to the nurse's office, while Officer Caldwell followed at a respectful distance. The Ashfords stayed behind, but I could feel their eyes boring into my back, already calculating their legal strategy and counting their settlement money. The nurse's office smelled like antiseptic and old bandages, and Lily sat on the examination table with her legs dangling off the edge, too short to reach the floor. Her right hand was wrapped in an improvised ice pack made from a plastic bag and paper towels, and when she looked up at me, I saw something in her eyes I'd never seen before. Not fear or guilt, but a kind of fierce satisfaction that made her look older than her 7 years, like she'd crossed some invisible line and knew there was no going back. Her knuckles were split and swollen. Blood dried in the creases of her small fingers, and I realized with growing horror that she'd hit Damien hard enough to injure herself in the process. The school nurse, Mrs. Kowalski, pulled me aside and whispered that Lily had refused to explain what happened, just kept asking if Tommy was okay, and I had no idea who Tommy was, or why Lily would be more concerned about some other child than the fact that she was about to be arrested. I sat down next to my daughter and took her uninjured hand, asking her as calmly as I could manage to tell me what happened, and she looked at me with those eyes that were suddenly too old and said 4 words that changed everything. "Damien hurt Tommy, Dad." My 4-year-old son Tommy had severe developmental delays, the result of complications during birth that had left him struggling with speech, motor skills, and social interaction. He attended a special needs program at the same school, in a different wing with trained specialists, and Lily was fiercely protective of him in a way that sometimes worried me. She'd appointed herself his guardian without anyone asking, walking him to his classroom every morning, checking on him during recess, defending him against any perceived slight with the dedication of a bodyguard. Now she explained in her small voice that during afternoon recess, she'd heard crying coming from behind the equipment shed where teachers couldn't see, and when she went to investigate, She found Damien and two of his friends surrounding Tommy. My son was on the ground crying, and Damien was holding his phone up, filming while the other boys laughed and pushed Tommy whenever he tried to stand up. Lily said she told them to stop, but Damien had just laughed and said something about getting views on TikTok for the retard crying, and I felt rage flash through me so intense I had to grip the examination table to stay grounded. She described how she'd tried to help Tommy up, but Damien had pushed her away and told her to mind her business, then deliberately kicked dirt in Tommy's face while still filming. That was when Lily had apparently grabbed Damien's phone out of his hand and demanded he delete the video, and Damien had responded by shoving her hard enough that she fell backward into the fence. According to Lily, he'd then leaned down and told her that the video was going up tonight, and everyone would see what a freak her brother was, and maybe next time they'd get him to do something even funnier. She'd gotten up, handed him back his phone, and when he turned away laughing, she'd punched him as hard as she possibly could right in the jaw, and my 7-year-old daughter had apparently hit hard enough to drop an 11-year-old boy like a stone. The nurse's office door opened, and Officer Caldwell stepped in, his expression apologetic as he explained that he needed to take Lily to the station now, and I found myself saying, "Wait," asking if they'd checked Damien's phone for the video Lily mentioned. The officer looked confused, said no one had mentioned any video, and I explained what Lily had just told me while he took notes with increasing interest. Principal Delacroix appeared in the doorway then, asking what the holdup was, and I repeated Lily's story while she listened with growing concern. She admitted they'd only talked to Damien and his friends, who all claimed Lily had attacked unprovoked, and no one had thought to check on Tommy or look for video evidence. We walked back to the principal's office in a small parade, and I noticed for the first time how Lily was holding her injured hand carefully against her chest, her fingers swollen to twice their normal size. The Ashfords looked up expectantly when we entered, and Mrs. Ashford immediately demanded to know why there was a delay in processing the assault charges. I looked at them both and asked as calmly as I could if they'd seen what their son had been doing before Lily hit him, and Mr. Ashford said with confidence that his son had been playing peacefully until he was violently attacked. Officer Caldwell cleared his throat and asked if they would object to him reviewing the contents of Damien's phone, and the temperature in the room dropped about 20 degrees. Mrs. Ashford started to say something about privacy and warrants, but her husband put a hand on her arm and asked what this was about. The officer explained that there were allegations of video evidence that might provide context for the incident, and Damien's face went pale in a way that told me everything I needed to know. Mr. Ashford looked at his son with new suspicion and asked in a measured tone if there was something on his phone he needed to know about, and Damien's eyes darted between his parents and the door like a trapped animal looking for escape. The silence stretched out for what felt like forever before Mrs. Ashford demanded to speak with her son privately, and Principal Delacroix offered them an empty conference room down the hall. They left in a tight formation, Damien between his parents like he was being marched to execution, and Officer Caldwell quietly asked me about Tommy's condition and what the relationship between the children was like. I explained Tommy's delays, Lily's protective nature, the way she'd been bullied herself in kindergarten for having a disabled brother, and how she'd learned to be strong because she had someone smaller who needed protecting. The officer made more notes and mentioned that if the video existed and showed what Lily claimed, it would significantly change the nature of the charges, possibly eliminating them entirely. We waited in uncomfortable silence for 10 minutes before the Ashfords returned, and I could tell immediately that whatever conversation they'd had in private had not gone well. Mrs. Ashford's professional composure had cracked slightly, stress lines visible around her eyes, and Mr. Ashford looked like he'd aged several years. Damien walked behind them with his head down, and Officer Caldwell asked again about reviewing the phone's contents. Mr. Ashford produced the phone from his pocket and handed it over without a word, his jaw tight enough that I could see the muscles jumping. Officer Caldwell scrolled through it for less than a minute before his expression darkened, and he turned the screen toward Principal Delacroix without comment. She watched for a few seconds, and I saw her face transform from professional concern to genuine horror, one hand covering her mouth as she finished viewing whatever was there. The officer asked if I wanted to see it, and I nodded, even though I already knew it was going to destroy me. The video was exactly what Lily had described, Tommy on the ground crying while Damien filmed and provided commentary that I won't repeat, his friends pushing my son and laughing while he begged them to stop in his limited vocabulary. The video was 2 minutes and 37 seconds long, and by the end I was shaking so hard I had to sit down. Damien had zoomed in on Tommy's face while he cried, had added text overlays mocking his speech, had even included a caption about going viral with "this retard's meltdown," and the casual cruelty of it was breathtaking. Officer Caldwell turned to the Ashfords and asked in a carefully neutral tone if they were aware their son had been recording and bullying a special needs child, and the silence that followed was deafening. Mrs. Ashford tried to recover, saying that boys would be boys, and maybe Damien had shown poor judgment, but that didn't justify violence, and I felt something snap inside me. I stood up and asked her in a voice I barely recognized as my own if she was seriously trying to minimize her son's systematic abuse of a disabled 4-year-old child, and her mouth opened and closed without sound. Mr. Ashford had the grace to look ashamed, staring at his son like he was seeing him for the first time, and I pressed my advantage by pointing out that the video showed clear evidence of assault and harassment of a minor. Officer Caldwell added that depending on how the district attorney viewed it, there could be charges related to disability harassment and creating harmful content involving a minor, and suddenly the Ashfords were the ones looking worried. Principal Delacroix found her voice and said she would be recommending Damien's immediate expulsion pending a full investigation, and Mrs. Ashford started to protest before her husband cut her off with a sharp gesture. The power dynamic in the room had shifted completely, and I could see them calculating the damage to their own reputations and careers if this became public. Officer Caldwell asked if I wanted to press charges against Damien for the assault on Tommy, and I looked at my daughter sitting there with her broken hand and fierce eyes and said yes, absolutely. The Ashfords began talking over each other then, Mr. Ashford suggesting we could handle this privately without involving the legal system, Mrs. Ashford offering to pay for any medical expenses and therapy Tommy might need. I listened to them negotiate against themselves for a full minute before I interrupted and said the only thing I wanted was for them to drop all charges and claims against Lily and for Damien to be held accountable for what he'd done to Tommy. Mrs. Ashford looked like she wanted to argue, but her husband was already nodding, seeing the writing on the wall that any lawsuit would expose their son's behavior to public scrutiny. Principal Delacroix said she would be contacting the district's legal team about the incident and recommended both families seek counseling for their children to process the trauma. The Ashfords gathered their things quickly, Damien still silent and pale, and left without another word, their exit lacking the righteous anger they'd arrived with. Officer Caldwell stayed behind to take formal statements, explaining that the video evidence meant Lily was unlikely to face any charges, and that the district attorney would review everything to determine if action against Damien was warranted. I asked if I could take Lily to have her hand looked at, and the officer nodded, handing me a card and asking me to bring her by the station the next day to finish the paperwork. We drove to the hospital in silence, Lily cradling her injured hand, and I kept glancing at her in the rearview mirror trying to reconcile this fierce defender with the gentle child who'd cried over a dead butterfly last week. The emergency room was crowded, but they triaged us quickly, once I mentioned the injury was from a fight at school, and we were taken back to an examination room where a nurse took vitals while we waited for the doctor. Lily sat on the bed swinging her legs, and I asked her if she was scared about what happened, and she looked at me with those two old eyes and said she'd do it again if she had to. The door opened, and a surgeon walked in, Dr. Isaiah Cartwright according to his badge, a tall man in his 50s with gray at his temples and the confident bearing of someone who'd seen everything. He introduced himself and gently examined Lily's hand, asking her to make a fist and wiggle her fingers while he palpated the bones. His expression grew more serious as he worked, and he ordered x-rays right away, explaining that he suspected fractures in multiple bones based on the swelling pattern. We waited 20 minutes for the imaging to be done and processed, and when Dr. Cartwright returned, he was carrying a tablet with the x-rays displayed. He showed me how Lily had fractured 3 metacarpal bones, the long bones in her hand, along with a hairline crack in her wrist that would need immobilization. The fractures were consistent with high-impact trauma, he explained, and asked what she'd hit with enough force to cause this kind of damage. I explained the situation briefly, and his expression changed from clinical concern to something more complex. He asked Lily directly if she'd punched someone, and when she nodded, he asked her to describe exactly how she'd done it, what position her hand had been in, and where she'd aimed. Lily demonstrated with her good hand, showing a straight punch aimed upward, and Dr. Cartwright's eyebrows went up. He pulled up a different image on his tablet, and I realized with shock that it was a CT scan of someone's skull, specifically the jaw area. The doctor explained that this was Damien's scan from earlier that afternoon, sent over by the oral surgeon who'd consulted on his case, and he pointed to the fracture pattern with something that might have been admiration in his voice. Dr. Cartwright explained that Damien's jaw was broken in 3 places, but not randomly. The fractures were precisely located at the weakest points of the mandible, where maximum damage could be achieved with minimum force. He asked Lily if anyone had taught her how to punch, and she shook her head, explaining she'd just aimed for where she thought it would hurt most. The surgeon looked at me and said something that made my head spin, that the punch Lily had thrown showed an intuitive understanding of anatomy that he'd rarely seen, even in trained fighters. He pulled up an anatomy diagram on his tablet and showed me how the angle of impact had translated force through the jaw's natural stress points, causing a catastrophic failure of the bone structure with a single strike. For a 7-year-old to accomplish this either by accident or instinct was remarkable, he said, and I wasn't sure if I should be proud or horrified. He asked if he could take a photograph of Lily's x-rays for a presentation he was preparing on pediatric trauma patterns, and I found myself agreeing in a daze. Dr. Cartwright carefully set Lily's hand in a splint and explained the healing process, prescribing pain medication and scheduling a follow-up appointment for 2 weeks out. As we were preparing to leave, he asked Lily one more question, why she'd chosen to punch instead of getting help from a teacher. She looked at him seriously and explained that the teachers were all inside, and by the time she found one, Damien might have hurt Tommy worse or posted the video. Dr. Cartwright nodded slowly and said that split-second decision-making under pressure was something they tried to teach medical students but rarely succeeded, and Lily had demonstrated it at 7 years old. He handed me his card and mentioned that if Lily ever had an interest in medicine, he'd be happy to mentor her when she was older, because that kind of instinctive understanding of anatomy was valuable. We left the hospital with prescriptions and instructions, and I still couldn't quite process what the surgeon had said about my daughter's intuitive knowledge. The drive home took us past Oakwood Elementary, and I saw Tommy's special needs classroom still had lights on, his teachers probably dealing with the aftermath of the playground incident. I decided to stop and check on him, and when we walked into the building, his teacher, Mrs. Fletcher, met us in the hallway with relief evident on her face. She'd heard about the incident from Principal Delacroix and had been trying to help Tommy process what happened, but he'd been asking for Lily repeatedly. We found Tommy in the sensory room, surrounded by soft pillows and dim lighting, and when he saw Lily, he lit up and reached for her with both arms. She sat down next to him carefully, protecting her injured hand, and he immediately snuggled against her side. Mrs. Fletcher explained that Tommy had told them about the boys being mean, about Lily making them stop, and he'd been worried that Lily was in trouble for helping him. I watched my daughter hug her little brother with her good arm and promise him the bad boys wouldn't bother him anymore, and he relaxed visibly against her. Mrs. Fletcher pulled me aside and mentioned that Tommy's regular teachers had failed him by not having better supervision, and the administration was implementing new protocols for recess monitoring. She also said that what Lily had done, while technically against school rules, had probably prevented much worse psychological damage to Tommy, and she wanted me to know that the special needs staff supported our family completely. We stayed for another 30 minutes until Tommy had calmed down enough to go home with us, and on the drive back, I kept glancing in the mirror at my two kids, one with a broken hand and the other with developmental delays, both of them stronger than anyone gave them credit for. That night, after I'd given both kids dinner and gotten Tommy settled in bed with his weighted blanket, I sat down with Lily to talk about what had happened. She was worried she'd disappointed me by fighting, and I had to figure out how to explain that I was simultaneously proud of her for protecting Tommy and terrified of the violence she'd been capable of. I told her that what she'd done was brave, but also dangerous, and that breaking someone's jaw could have had consequences that lasted the rest of her life. She listened seriously and asked if Damien would be okay, and I was struck by the fact that she was concerned about the boy who'd tormented her brother. I explained that his jaw would heal, but what he'd done to Tommy might take longer to recover from emotionally. Lily asked if she was going to jail, and I pulled her into a hug and promised that no one was taking her anywhere, that Officer Caldwell had said she was defending her brother, and that made all the difference. She cried then, finally, the adrenaline and shock wearing off to leave behind a scared 7-year-old who'd done something that terrified her in retrospect. I held her until she fell asleep on the couch, then carried her to bed and sat watching her breathe for a long time, trying to understand how this small person had found the courage to do what she'd done. The next morning, we drove to the police station to complete Officer Caldwell's paperwork, and he met us in a family-friendly interview room with soft chairs and toys in the corner. He asked Lily to tell her story one more time on the record, and she went through it calmly, her voice steady as she described finding Tommy being bullied and making the split-second choice to act. Officer Caldwell's expression was kind as he listened, and when she finished, he told her that protecting family was one of the most important things a person could do and that she'd been very brave. He explained that because Damien had been actively hurting Tommy and filming it, Lily's actions would be classified as defense of another, which was legally justified under the circumstances. He also mentioned that the district attorney had reviewed the video evidence and decided to pursue charges against Damien for assault and harassment of a disabled minor, which could result in juvenile court intervention. Officer Caldwell asked if we'd consider allowing Lily to give a victim impact statement when the case went to court, and I looked at my daughter, letting her make the choice. She thought about it for a long moment before nodding, saying she wanted the judge to know what Damien had done to Tommy and why she'd stopped him. We left the station with assurances that no charges would be filed against Lily, and I took her for ice cream on the way home because she'd handled an impossible situation with more grace than most adults could manage. She ordered mint chocolate chip and swung her legs under the table while she ate, the splint on her hand making the simple act awkward, but not impossible. I asked her if she understood why what she'd done was complicated, right, but also dangerous, and she nodded, saying she'd been scared, but more scared of what would happen to Tommy if she didn't act. That kind of moral clarity was startling in a 7-year-old, and I realized I'd underestimated my daughter's capacity for courage. My phone rang then, an unknown number that turned out to be Mr. Ashford calling from his personal cell. He asked if we could meet to discuss the situation, and I almost refused before curiosity got the better of me. We agreed to meet at a coffee shop near the school the next morning, neutral territory where we could talk without lawyers or administrators listening in. I spent that evening wondering what he could possibly want to say that hadn't already been covered, and whether this was some kind of legal trap I was walking into without realizing. The coffee shop was busy with the morning rush when I arrived, and Mr. Ashford was already there, sitting at a corner table with 2 cups in front of him. He stood when he saw me. His professional attorney demeanor cracked to show genuine exhaustion underneath. He pushed one of the cups toward me and said simply that he was sorry, and I sat down, waiting for the other shoe to drop. He explained that he and his wife had been called to the school twice before this year for incidents involving Damien bullying other students, but they'd dismissed it as normal kid conflict and hadn't taken it seriously. Seeing the video of what their son had done to Tommy had forced them to confront the reality that they'd raised a child capable of deliberate cruelty, and they were struggling with that knowledge. Mr. Ashford said they'd decided to enroll Damien in intensive therapy and remove him from public school entirely, sending him to a program that specialized in behavioral intervention for troubled youth. He pulled an envelope from his jacket and slid it across the table, explaining that it contained a check to cover Tommy's therapy costs for the next 2 years, along with a formal apology letter and a promise to drop any consideration of legal action permanently. I opened the envelope and saw a check for $50,000, along with a handwritten letter from Mrs. Ashford expressing genuine remorse for their son's actions and their own failure as parents. Mr. Ashford said they weren't trying to buy forgiveness, but they wanted to at least try to make amends for the harm Damien had caused. He asked how Lily's hand was healing, and when I explained the fractures, he winced and said their oral surgeon had told them the same thing Dr. Cartwright had mentioned, that the punch showed remarkable precision for a child. Mr. Ashford looked at me with something that might have been respect and said that Lily had more courage in her 7 years than he'd shown in 43, and that he hoped Tommy recovered quickly from the psychological trauma. We talked for another 20 minutes about our kids, about the impossible job of raising them right, about the ways parents could fail without meaning to. When we parted ways, I actually felt something like sympathy for him, watching his son's true nature revealed and having to deal with the consequences. I drove home and showed my wife the check and the letter, and we sat together deciding what to do with it, ultimately agreeing to put it in a trust for Tommy's future care and therapy needs. 2 weeks later, we returned to the hospital for Lily's follow-up appointment, and Dr. Cartwright examined her hand with satisfaction, noting that the bones were healing well and she'd regained full function within 6 weeks. He asked how she was doing emotionally, and Lily explained that she'd been seeing a child therapist to talk about the incident and her feelings about hurting someone. Dr. Cartwright nodded approvingly and said that processing violence, even justified violence, was important for healthy development. He asked if he could show her something and pulled up his tablet to display a presentation he'd given at a medical conference the previous week. One of the slides showed Lily's x-rays alongside Damien's CT scan, with annotations explaining the biomechanics of her punch and the resulting trauma pattern. Dr. Bada Cartwright explained that he'd used the case to teach emergency medicine residents about defensive injuries and the ethics of treating children involved in violence. He'd presented it anonymously, of course, but the medical community was fascinated by the precision of the injury relative to the age of the person who'd caused it. He looked at Lily seriously and said that if she ever decided to pursue medicine, she should remember that understanding how to cause harm was the first step in learning how to heal, and that her instinctive grasp of anatomy could save lives instead of breaking jaws. Lily asked if she could have a copy of the x-ray, and Dr. Cartwright laughed and printed one out for her, signing it at the bottom like an autograph. She folded it carefully and put it in her pocket, and I realized my daughter was keeping it as a reminder of what she was capable of when people she loved needed protecting. We left the hospital with a clean bill of health and a prescription for 6 more weeks of wearing the splint during strenuous activities, and as we walked to the car, I asked Lily if she regretted what she'd done. She thought about it seriously before shaking her head and saying she wished she'd been able to stop Damien without hurting him, but given the choice again, she'd make the same decision to protect Tommy. That kind of moral certainty was both inspiring and terrifying in a child, and I knew I'd spend the rest of her childhood trying to help her channel that protective instinct into something constructive rather than destructive. We drove past Oakwood Elementary on the way home, and I saw Tommy's class outside for recess, supervised by 3 teachers instead of the usual one, the new safety protocols already in effect. That evening, Officer Caldwell called to let us know that Damien's case had been processed through juvenile court, and he'd been sentenced to a year of court-supervised therapy and probation, along with community service at a special needs facility where he'd learned to understand the population he'd victimized. The judge had apparently been particularly harsh after viewing the video evidence, calling Damien's behavior a calculated act of cruelty that warranted serious intervention. Officer Caldwell also mentioned that 2 other families had come forward with complaints about Damien bullying their special needs children, and the school was conducting a full investigation into how his pattern of behavior had gone unchecked for so long. The district had implemented new training for all staff on recognizing and responding to disability harassment, and Principal Delacroix had personally apologized to our family for the supervision failures that allowed the incident to occur. I thanked Officer Caldwell for his help and hung up, feeling like maybe something good had come from the nightmare. Systemic changes that would protect other vulnerable kids from falling through the cracks. Lily was doing her homework at the kitchen table, writing carefully with her splinted hand, and Tommy was playing with blocks nearby, occasionally looking up to make sure his sister was still there watching over him. 3 months after the incident, I got a call from Dr. R. Cartwright's office, asking if Lily would be interested in participating in a youth mentorship program he was starting at the hospital. The program would pair interested children with medical professionals to learn about healthcare careers, and he specifically wanted Lily involved because of the aptitude she'd demonstrated. I discussed it with her, and her eyes lit up at the idea of learning how bodies worked and how to help people heal, and I realized she was channeling what had happened into a positive direction without anyone forcing it. She started attending monthly sessions at the hospital, learning basic anatomy and first aid, and Dr. Cartwright seemed genuinely invested in nurturing her interest in medicine. He told me privately that he'd never seen a child grasp spatial relationships and anatomical concepts so quickly, and that if she maintained her interest, she had the potential to be an exceptional surgeon someday. The irony wasn't lost on me that my daughter's violent defense of her brother had somehow opened a door to a career in healing, and I wondered if that had been Dr. Cartwright's intention all along. Lily's hand healed completely, leaving only faint scars across her knuckles that she traced sometimes when she thought I wasn't watching. Tommy thrived in his special needs program with the increased supervision and support, and while he still sometimes asked about the mean boys, Lily's fierce protection had given him confidence that someone would always keep him safe. The Ashfords kept their promise about therapy funding, and Tommy started seeing a specialist who helped him process the trauma and develop coping strategies for anxiety. My wife and I watched our children navigate the aftermath of violence with surprising resilience, and we learned that sometimes protecting family meant making impossible choices that couldn't be neatly categorized as right or wrong. Lily never bragged about what she'd done or tried to leverage it for social status at school. She just quietly went about being the same gentle kid who collected injured butterflies, except now everyone knew there was steel underneath the softness. And when Dr. Cartwright asked her during one of their mentorship sessions why she'd chosen to hit Damien instead of running for help, she'd looked at him with those two old eyes and said simply that sometimes you don't have time to find an adult, sometimes you just have to be the adult yourself. He'd written that quote down in his notebook, and later told me it was the most mature thing he'd ever heard from a 7-year-old. Years later, when Lily was filling out college applications and writing essays about formative experiences, she'd tell the story of the day she broke a boy's jaw and a surgeon asked for her autograph. She'd write about learning that protecting others sometimes required violence, but that understanding violence was the foundation for preventing it. She'd describe Dr. Cartwright's mentorship and how it had shaped her decision to pursue trauma surgery, specializing in pediatric cases where she could help kids who couldn't help themselves, and she'd include a photocopy of that signed X-ray he'd given her, the physical reminder that sometimes the worst moments of our lives point us toward our true purpose. I kept my own copy of that X-ray in my office desk drawer, pulling it out occasionally when I needed to remember that my daughter was stronger and braver than I'd ever given her credit for, and that sometimes the most important thing a parent can do is step back and let their kids be the heroes of their own stories, even when it terrifies us to watch them fight their battles. The surgeon had asked for her autograph because he recognized something in that violent act of protection, a precision and purpose that transcended the simple labels of right and wrong, and in doing so, he'd given Lily permission to own her strength instead of being ashamed of it. That gift, more than anything else, was what helped her heal from the trauma of that day and transform it into something that would let her spend her life healing others. Appreciate you watching this far. If you enjoyed it, drop a like, leave a comment, and subscribe so you won't miss the next story.